guys, Dr. Joseph Bogart here, chiropractor in Parkland, Florida. I've been practicing for about 20 years now, and I've served many patients over the years. And something that commonly comes up is, what can patients do when they can't get to the chiropractor? Okay, for instance, it's a Saturday morning and I'm out of town and a patient calls me up and says, man, I blew up my back. What can I do till I can see you on Monday? So here are some great top 5 things that you can do, maybe even 6, until you can get in to see your chiropractor, okay? So first, let's start off with the fact that there are many different causes of back pain. And so unless you know exactly what's causing it, is it a subluxation from a misalignment? Is it a disc that's bulging or herniated? Is it a facet syndrome? Is it, God forbid, a tumor or some other pathology? Is it a stenosis? Is it a spondylolisthesis? Unless you know exactly what's going on, it's really hard to diagnose. So these videos or things I'm showing you in the video are generalizations and things that if they hurt, stop doing them and back off, okay? The things that I'm showing you really shouldn't hurt any more than your back already does, okay? So the first thing I want to show you or explain to you is the difference between ice and heat. So people will often call me, oh my God, it's Sunday morning. What do I do, ice or heat? If the problem started, or the pain I should say started, within the last 24 to 48 hours, do ice only. If it's been longer than that, then we typically or generally recommend heat. However, I like the combination of ice and heat if it's past 48 hours from its initial onset, meaning 10 minutes of hot, 10 minutes of nothing, 10 minutes of cold. And the reason is that the hot will bring in new circulation to help the tissue heal. The rest will let the tissue go back to normal. And then the cold will pull a lot of the swelling or the waste product or other tissue from the aggravated area that's inflamed out of that area, okay? So that works really well. 2, something that people say, all right, doc, I'm in a lot of pain, what can I do? So I say if someone has access to one of these exercise balls, the best thing, or one of the best things that a person can do would be to lay carefully on your stomach on this ball and let your upper body get very heavy and traction out, and let your legs and your hips get really heavy and basically traction out. And just lay here for about a minute or 2, rocking back and forth slightly, maybe side to side, forward and back. You could use your toes, you could use your hands. What that typically does is it opens up the joint space, it opens up the discs, it opens up the facets, and it gives a lot of those nerves that are being pinched a little bit of room to breathe. That's a really powerful stretch to do. However, the other things that you can do as well is that's one type of a stretch. Some people feel better unless you have like a spondylolisthesis. I don't recommend this, and if you don't know if you have that, you can try this, but if it bothers you to stop, is to lie on your back and stretch your back this way, lying face up and stretch. So some of you are saying, well, I don't have one of these exercise balls in my living room. What am I gonna do? So something you can do is you can lay on your bed and get some type of a pillow or something that will space occupy, for instance, something like this, and lie on your stomach on that. And that can be used, you can use your arms, your toes to kind of traction your body out. That's another way to do that if you don't have one of those in your home. If you do, then those are great. And I highly recommend getting for $20 from Walmart, Target, places like that have them, okay? Or even like Ross, Marshalls, TJ Maxx, things of that nature. All right, and something else, another exercise. Number 3 is something called the 3 C's. I call it the cat, the camel, and the C. The first is the cat. The cat, you're gonna be on your hands and your knees, either on your bed or on the floor, and you're gonna take a deep breath in, and you're going to put your belly down towards the bed or the floor while you pick your head up, and then you're gonna inhale and make your back arch like a camel, and then out like a cat. Up like a camel, out like a cat. And then the third part of the 3 C's is taking your body while keeping your knees in one spot and rotating to one side to make a C and rotating to the other side to make a C. If that starts to feel better, you can continue to do those in reps of 10 of each. If it starts to hurt or make it feel worse, obviously stop doing that. Okay, number 4, which is really good, because a lot of people tell me it's my lower back and or my hips, and unless you have a hip problem, which some people do, and if you do, I don't recommend this, is to cross your leg over, keeping your back straight. Now I'm on a wobble ball, so this is a little bit harder to do than if you're sitting in a chair. You can do this in a chair, I recommend. With your back straight, put your chest towards your foot. If I arch my back, obviously I can go much further. But if I have my foot like this, my knee as far down as it can go, and my back is straight and I put my chest forward, that's about as far as I go. And I'm gonna feel a really good stretch in my glutes, in my deep rotators of my hip, and in my hip joint, especially with the SI joint or sacroiliac joint for the lower back. And this also, if you do this on either side, will help, okay? And again, you don't wanna put your chest straight forward, you wanna put it towards your foot, so slightly on an angle away from that glute or that hip, and you'll feel it. You'll know when you get there, all right? That's another great stretch that you could do in the meantime. And the fifth thing that I'm gonna recommend, particularly excellent if you have a sciatica, which is a radiating pain into the butt or the back of your legs, whether it goes down in the thigh all the way down to the foot, is what's called the McKenzie Exercises. I didn't invent this, but this is a great exercise. I recommend it to patients to do. It's a form of physical therapy. And what you can do is, while you're laying on your bed, you would lay on your bed for about 30 seconds or so, as flat as you can, face down, let everything kind of relax. And once everything's kind of relaxed, you can literally come up to your elbows. And while you're on your elbows, you're gonna use your elbows and almost pull your body slightly forward. What that's gonna do, it's gonna traction out that lower back a little bit. And that's gonna feel really good, and that will oftentimes take a lot of the sciatic or radiating pain out of the legs as well as in the lower back. Hold that for 10 to 30 seconds, depending on how much you can tolerate, and then literally just rest back down like this for another 30 seconds. Then come back up and do this repeatedly. You can do, there's no set number of times you can do this. If you can, let's say that feels really good and you feel like you can go further, you can go up on your hands and press up like this. If that recreates pain or radiating pain down into your legs or your lower back, obviously stop, okay? And then when you're done with that, you can come back down. Now, a little trick that I found is that when people are up like this, sometimes people will feel a little bit better if they lean to one side or they lean a little bit to the other side, where that will actually take a little bit more pressure off of those nerves and off of those discs. What this exercise does is that by pushing the back into an extended position, it actually helps push that disc material forward, because oftentimes when people have herniated or bulging discs, it's extending backwards, either into the central canal or into the foramen, which are the holes where those nerves come out. So that helps to actually push them back in. Do not do anything violent or ballistically. You want to just gently get into that position and then come down. And finally, there's another portion to that exercise that's very helpful, which is standing with your body up against the wall like this, okay, without moving the camera. And your arm is here. You're gonna literally shift your hip towards the wall. So I would look like this if I was against the wall here. Shift your hip towards the wall and back. Shift your hip towards the wall and back. Do that a number of times, and then do it a number of times this way. Shift your hip towards the wall and back. Shift the hips towards the wall and back. That's another part of, or another lateral or side way to do the McKenzie exercises. And if one side feels better than the other, do that side. If the other side hurts or recreates pain, particularly down the legs, stop doing that side. So I know that's kind of, most people say, well, obviously, but you'd be amazed at how oftentimes people do things that feel bad, but they think they're actually doing something good. So again, listen to your body. If it hurts, any of these exercises hurt or seem to make it feel worse, stop. Of course, get to your chiropractor when and if you can. If you don't have a qualified chiropractor, find one. If you don't know one and you'd like me to help you find one, depending on where you live, I can help you find one that's good. I'm located in Parkland, Florida, serving people in Coral Springs, Coconut Creek, Boca Raton, all the way down to Hollywood, Delray. So we got a lot of people that come to us. If and when we can get you in on Monday, we'll get you, worked on, and we'll get you feeling a lot better. But these are things you could do until you can get in to see your chiropractor, okay? Any comments, questions below, leave them in the link. You can subscribe, share this video with people you know. Hopefully I can help a lot of people with this until they can get in to see their chiropractor. This is by no means a replacement for chiropractic, or if they need further orthopedic care, possibly even surgery if they have a major problem. But this is something to hopefully get them through that weekend until they can see them. Thanks a lot, guys. Appreciate it. Like and subscribe. See you soon. Bye-bye.